Hi, everybody. I'm going to go ahead and start. And this recording will be made available to anybody who signed up. But I'll also post in the community forum that anybody who wants this presentation can certainly get it from me. So what we're going to do tonight is talk about warm-ups and cool-downs for the voice. I am basing this on what I know, not only as a voice actor, but as a singer. So some of this comes from my training as a singer. Anybody who's ever taken a voice lesson will probably recognize some of it. But it's also for anybody who uses their voice to make a living. So a teacher, anybody who lectures on a regular basis, all of this kind of thing that requires the use of the voice. It is very wise to know how to take care of that instrument. And just so you understand, your vocal cords are soft tissue, and you need to take care of them. There's lots of reasons why. So, Rob, can we scroll up to the next slide, please? So here's what we're going to go through tonight very quickly. I'm going to show you a couple of slides that give you a brief anatomy of your breathing apparatus, which is basically your lungs and your body, and then your voice box, your larynx, and all of that. So you understand exactly what we're warming up. Then I'm going to walk you through some facial and body warm-ups. We'll look at how you can warm up your mouth and your voice box for creating vowels and consonants, and then some suggestions for cool downs and a brief discussion about vocal health and vocal rest. And those are different. So go ahead to the next slide, Rob. So here is a very simplified diagram of most of what is involved when you use your voice. So you have what are known as resonators in your head. I'm going to go from the head to the diaphragm. Your nasal cavity, your nose, your mouth, your tongue, your cheeks, your head, your actual head, all of those things have open spaces in which sound is going to resonate. And it resonates in your head first, and then it comes out your mouth when you open your mouth to make a sound. So that's why you want to warm up your face and your tongue and your cheeks, which we're going to do in a minute. Then in your throat are the epiglottis. The soft palate is almost in your throat. That's actually the back of your tongue. The hard palate is the roof of your mouth. And you use those two things to create vowels mainly, although some consonants happen there. And then further down in your throat, there's a bone structure. So the little white piece that you see that's right past the word tongue, that's where the hyoid bone is. And then below that, just below that, are your vocal cords. They are two pieces of soft tissue. They're almost like cartilage. And they are stretched across your esophagus. When you speak, they vibrate and they are brought together and they swing apart. So where damage might happen is if those vibrations are too strong, if there's not enough moisture in your throat, if there's any kind of swelling in that area. What we talk about when we talk about nodes, those are actual growths on and around the vocal cords. They can be very dangerous. You can actually lose your voice permanently. Some people, unfortunately, suffer a paralysis of the vocal cord so that you only have one or the other vibrating instead of both. So there's lots of things that can go wrong. But if you take care of your vocal cords and exercise them the way you would any tissue, muscle specifically, there's no reason why you cannot be healthy and happy and singing and voice acting into your later years. There's absolutely no reason for that. So then we go into the larynx. That's musculature around your throat. As you get into the esophagus and the pleural membranes and the trachea and all of that, that's mainly the apparatus for breathing, but you need to be aware of how far down your lungs go. Most people don't realize that they actually go down almost to your hips. They're very big organs. So when you're breathing, and that's why people talk about diaphragmatic breathing, there's a muscle panel along the bottom of your lungs that helps you to breathe. And one of the techniques of singing is something called diaphragmatic breathing, where you become aware of that muscle shelf that is the diaphragm, and you're able to some degree, manipulate it. It's not completely under your control. Some of it's autonomic, but you do need to be aware, I would say, more about how deep your lungs are and how it feels in your body to fill your lungs with air. Most of us never do. We know how to breathe when we're children, and then we lose that skill because we're taught to breathe differently. So if you're taking any kind of voice class or acting class, very often what you'll be taught is how to breathe safely and in a relaxed manner. One of the worst things you can do as a voice actor or a singer is do what we call build tension. So if you are breathing like this and your shoulders are moving, and I'm exaggerating quite a bit, but if you feel tension in this part of your body, you're actually fighting against yourself. Good breathing is very relaxed and should happen almost naturally. And if you just try something for me, if you let all the air out of your lungs, go ahead and blow it all out, and then don't do anything, your body's going to automatically take in air. That's the way you want to breathe for voice acting and for singing. But since we're talking about voice acting, we'll stick with that. So then, Rob, could you go to the next slide? Because I want people to see a little more detail about the resonators and where your voice box and all of that is. So you see how there's the oral cavity, which is the inside of your mouth. This is the diagram on the left. And then you have the nasal cavities. There's actually 4 of them. There's 2 underneath your eyes. There's 2 right above your eyes. And these are the things that hurt when you get a cold or if you have allergies. These are where sinus headaches happen. But those are also where sound resonates. Then you have the tongue, which helps you make vowels, depending on where you put the tip and the soft palate or the back of the tongue. And we'll go over that in a little bit. Then you also have the glottis, the epiglottis, the supraglottis. Those are all those sort of glossy red tissues in the back of your throat, if you've ever looked in the back of your throat. And the glottis is what helps you to swallow. It's part of the swallowing mechanism. So when you're talking, it's in one position. If you're going to swallow, it's in a different position. And you know when it's in the wrong position because if you've ever inhaled water, you're going to choke it back up. That's a reflex. And then, of course, you have the esophagus and trachea and all of that going back down to the lungs. So if you look at this diagram on the right, it shows you where the epiglottis and the thyroid gland are, and all of those folds that are around the vocal cords. That's the little tiny spot in the middle. And then you have all this cartilage that goes down on your trachea and that kind of thing. So I just want you to understand sort of a general sense of anatomy, because these are the things that we're going to be warming up. These are the things that you need to be careful with. And if you're a little fatigued, that you need to baby a little bit. Okay, so the next slide is what I'm going to do first, which is the facial and body warm up. These are very, very easy. All you're going to do first is rub your face. Take your hands, just your fingers. Don't grip with your thumbs. You don't want to put your thumbs under your jaw. That'll be uncomfortable and you might trigger your gag reflex. All you're going to do is massage your face like this, and go ahead, everybody, try it. And you're going to go all the way up your temples, and you can feel your muscles under the skin, and you can feel where the tension might build. For me, I often get tension right here where my jaw, and just so you know, your jaw comes all the way up here, and then there's a muscle that attaches right here at your temple. So if you have any kind of jaw tension, you're going to get a headache because those muscles come up and into these muscles here on your face. If you've ever seen an anatomical drawing of the face, there's lots of little tiny muscles here up on your forehead. And then there's a big round basket shaped muscle here around your mouth. And then there's lots of sinews and cartilage here on your cheeks. So that's the kind of thing that you're just trying to get to relax like this. And just gently touch your nose. I mean, and what feels really good, I'm going to take my glasses off for a minute. What feels really good is do that with your fingers and massage under your eyes, right? And above your eyebrows, right along the bone ridge there, and down the nose and under the cheekbones. And you'll feel your face just start to tingle and get kind of relaxed. Then what you can do is gently take your thumb and forefinger and not pinch, but sort of roll these muscles along your jawline a little bit. And what I often do is take that knuckle and just gently, you're not trying to, this isn't deep tissue. You're just trying to get that muscle to let go a little bit, right? And then gently just take your hands like you're washing your face. And what this does is stimulate blood flow just enough so that you feel like you're blushing a little bit, right? Then, and I'm going to stand up, you're going to do the rest of your body. And this is very easy. It doesn't take very long to do. You're going to flop right over like a rag doll. And then imagine someone's got fingers on your spine, and they're going to slowly walk up your spine. With you flopped over, what that means is you're going to roll up one vertebra at a time, and you only have to do this once. And what you're doing is aligning your spine. You're trying to straighten it. When you get to standing, bring your shoulders, roll them back, and you're going to stand straighter. I promise. Do that even if you know you're going to be sitting. Because what you want, the reason you want your spine in alignment is that is going to help your breathing, right? If you're hunched over like this, or you're arching your back, there's tension in your chest and your back that's going to interfere with your lungs being able to breathe. So that's why you want to get your upper body and your spine a little bit relaxed, but you don't have to do that but one time. Then the next thing is, and I forgot to get something, so I'll be right back. Hold on. In your booth, you should have a cup with a straw in it. Here's why. To activate your breath before you do any vocalization for about 30 seconds, blow bubbles. That's it. The reason you do that is it introduces to your body, oh, I'm going to be sustaining breath, because that's what talking is. Yes? If you're just breathing normally, there's a rhythm that you might be aware of, but you're not necessarily aware of doing it, right? And especially with singing, singing is sustained talking, essentially. So what you're trying to do is introduce to your body the idea of sustaining breath, right? This is also a good way to build breath. So you can increase the time. I don't know how long I can do it. I'm not going to demonstrate it now, but let's say I can do this for 30 seconds, right? Then maybe in a week, after doing it 30 seconds every day, do 35, do 40, do 45. And as you build up, you'll get to the point where you can do it for a couple of minutes and not have to take a breath. And that teaches your body breath control, which is great for long form. But it's also really good, I think, for short form stuff, because you're going to want to be able to yell, or you're going to want to be able to change gears very quickly. And if you know what your breath is capable of, it's going to help you do that. Okay. So then you're going to start warming up your voice. The best way to do this is softly, gently, especially if it's in the morning. How many people, and I'd be surprised if people don't say this, how many people notice that when you wake up in the morning, your voice is lower? I know I do. Okay, so what that means is your vocal cords are tighter. They're shorter. So you don't want to start jumping into high stuff, talking normally, talking loudly, yelling, with vocal cords that are not warmed up. So, yawn. And you can make yourself yawn. It's not just a reflex. You can make yourself yawn. Hum. And it doesn't have to be a melody. You can just go, right? And then sigh. The best way to sigh is this way. Take in the air through your nose, but leave your mouth open slightly and press your tongue up slightly to the roof of your mouth so that you're getting really nice, cool air. And then, and try not to vocalize too much. You don't have to put any tone behind it yet. Just, okay. Do that, I don't know, 2 or 3 times each. Then you're going to explore the mask. So the mask for singing and speaking is this part of your face here, around your eyes. And it's basically comprised of the cheeks, the nasal passages, a little bit of the forehead, right? So what you want to do is quietly say these 2 letters together, NG, and just, and where you should feel it is behind your nose. And if you want to try it, I know everybody's muted, go ahead and try it. The other way you can do it is hung, the word hung, H-U-N-G, hung ye, Y-E-E. And that will get, hung ye, and that will get all this vibrating a little bit, and you'll feel it. It'll tickle. The other way you can do it is do a motorboat, and sometimes the vibrations will go up this way. You can also do it by just like yeah. So say yeah, but really nasally. Yeah. And where I'm feeling that on me anyway is way up here. Not even behind my nose. It's way up in my forehead. Yeah. Once you do that, you move on to what are called vocal sirens and glides. So you know what a siren sounds like, right? So up and down. And then glides are, and do low as well as high. So, and make sure you open your mouth so the sound can get out. Then there's tongue and lip stretches. So these are really weird. First, you look like a monkey. So what you're going to do is press your lips together and force air into your mouth so that it only comes here and here. Only here and only here. Then you're going to go and then do the other side. And you can switch them back and forth. Then you're going to, like a blowfish. And where you're going to feel that, where I feel it, is, I'm sorry, this is going to be gross, right there. These muscles here above your teeth, inside your mouth. And that's going to help you make consonants, right? Then tongue exercises, those are hilarious. So you can hold the tip of your tongue and wiggle it back and forth. All right. Then you're going to touch the tip of your tongue to your nose. I'd be surprised if you meet it. Some people can. And then down. And then you're going to go this way. And then that way. And then you're going to go, like you're licking your lips. Both ways. And then you're going to do one of my favorites in yoga. I know your mouth's going to get wet. This is called the lion breath in yoga. It's great fun. So here's what you're going to do. Take a nice, relaxed, you can even close your eyes if you want, deep breath. And when you exhale, here's the face you're going to make. Okay? So the idea is to stick your tongue out as far as it'll go, your mouth as open, as wide as it'll go, your eyes are open as wide as it'll go, because what that activates is your whole face. Okay? Then you move on to vowels. Vowels are made with the tongue. To do just a relaxed vowel. Ah. Ah is your mouth open, maybe the width of 2 fingers. Ah. Your tongue is totally relaxed. There is no tension front or back. Ah. You can turn ah to ooh, ow, by simply closing your lips into that O shape. Ooh, ow, ow. And that's actually a good, and you see it down on the slide. Wow, wow, wow. And that's a really great way to get that vowel in your space. Ooh. Then you want to go like set or bet. Is I, and all I'm doing is closing my lips into a slight smile. I, and my mouth gets a little wider at the corners and my teeth come in. So if I'm here, I, maybe another finger width. And then E, you're going to lift your soft palate. I, E, and there is a little tension on the tip of the tongue up against the bottom teeth, but you don't want to build tension in your tongue. You want that to be relaxed. What you're really doing is closing the space in the back of your throat. E, I, because what you don't want to do is this. E, that's too broad. E, and it becomes nasal. E, that's an exercise you can do, which we're going to do in a minute. But when most people speak, if I say the word speak, I don't say speak unless I want to do an affectation. The normal vowel is E, and all I'm doing is raising the back of my tongue. E. So E, and then O. You're making your mouth the O shape, but it's a little taller. O, oo. So yow. So you could start doing the what I call the yow and why. Yow, why, yow, why. And those are all the vowels in a glide. Why, yow, why, yow. Then you can do oh, wow, wow, wah, like that. And then you can also do wee, wee. So those will get you through all the vowel sounds. And I think somebody diagrammed when somebody does this glide, there's like 80 vowels in there or something crazy because there's diphthongs and triphthongs and all that kind of stuff. Don't worry about it. Just do the 5 basic ones. So you want to do me me mamo moo me me mamo moo me me mamo moo me me mamo moo. That will also warm up your lips. Wee you wee you wee you wee you. Oh wow wah and why yow. Just do it for 2 or 3 times each. You'll feel your muscles get loose and you'll be in good shape. Then you want to work on your consonants. There's a couple of ways to do this. Gutta gutta gee, gutta gutta ga, gutta gutta go, gutta gutta goo. That's a theater exercise that I've known for a long time. There's a singing exercise that I do, but I think you can do it speaking too. It's bb bebe bb bebe bb bebe bb bebe c c say say c c say say. So it's the same vowel, but you're going to put consonants in front of it. So bb bebe c c say say d d day day fi fi fe fe gi gi gay gay he hey hey. Some are harder. He hey hey g g j j gi gi gay gay I h I j. Kiki, KK, Lili, Lele. When you do an L for singing, anyway, it's not Li, Lay, Lay. No, it's Lili, Lele. It's just up against your tongue. Sorry, your back, the tip of your tongue to your back of your teeth. Lili, Lele, Lili, Lele. And Mimi, Meme, and Nini, Nene is just your bottom jaw. Nini, Nene, Mimi, Meme, Nini, Nene, Mimi, Meme. Pee, Pepe, Qui, Que is hard. Qui, Que. Ri, Ray, Cici, TT, Vivi. Yee is also hard. Wee, ZZ. Just do it as fast as you can do it. And what you'll discover is you keep doing it each time you warm up and you'll get better and better and better at it. Then there's wide mouth frog. Wide mouth frog. That combines consonants and vowels. Wide mouth frog. And then tongue twisters. Yay! Which is the next slide. So these are just a few that I use. There's so many. And as I say, I'm going to send you this PDF. The 2 addresses at the bottom, there's like 25 or 30 at each of these websites of tongue twisters. And that's really just to get you making words in a kind of a speed method. It's sort of like doing a speed read through of a script when you're trying to memorize. You can do speed read throughs of your scripts if they're short enough. You can do tongue twisters just to get yourself ready to do long form. Red leather, yellow leather, red leather, yellow leather, red leather, yellow leather, 6 thick thistle sticks. She sells seashells by the seashore. And my favorite is the next one. I slit a sheet I slit. Upon a slitted sheet I sit. Do that fast and tell me you don't swear. If you do, you're lying. And then, a big black bug bit a big black bear and the big black bear bled blue. I mean, there's so many. You can do your script in the style of a GNS patter song. That's another great exercise. And then you're warmed up. So that should take you, I don't know, between 10 and 15 minutes. Depends on what you want to do. You may not have time to do all of that. So here's a couple really short ones. You want to do motorboats? If you do nothing else, you should do these 3. Motorboats, sirens, woo, woo, and open your mouth when you do it. Woo, woo, and take your jaw, these fingers, jaw. What I'm doing is grabbing my chin and wiggling it. And do it as fast as you can do it. And what that does is loosen this joint here. Okay. We don't have to go back to the slides for this. You're going to get this when I send it out. Cool downs. So cool downs are almost as important as warm-ups because, like any muscle, if you just stop, lactic acid's going to build up and the possibility of soreness in these muscles will happen. And I have been in situations where I've done a lot of singing, a lot of reading, and you can feel it. We've all been there. You can feel it. It's right here. Your voice is a little husky, maybe, but there's a soreness right here. So what you want to do is get a straw. This is actually a little too thick. You're going to sing through the straw. Okay. So you put it in your mouth and you seal it with your lips. So don't let any air escape around the straw. And if you can avoid when you're singing, and I'll tell you what to sing in a minute, try to keep air from coming out of your nose too. That's helpful. So you're going to sing Happy Birthday. And of course you have to breathe in to take a breath. But then when you breathe out, you're going to breathe through the straw. It's better if the straw is thinner. So think coffee stirrer thin, right? There's actually a company that will sell you your own little vocal straw in a little bag, and it's a little metal straw. I have a link to it if you're interested. But you do that for 2 minutes, and that's it. You're good. You're done. But what it does is help the air come back down into your throat without you're doing a lot of athletic machination down here, right? The other thing you can do is hum, sing quietly. And then, how about this? Silence and drink water. So if you can, even if it's only 10 minutes, but 30 minutes is ideal, just don't talk. Just and sip your water. Okay. Lip flutters are another way to do it. You can go. And so, for example, if I'm coming back from a rehearsal or I've been in my booth for a long time, I grab my straw or I just hum and I just, walk around the house or I'm driving in my car or whatever and just couple minutes. That's all you need to do. And you are sufficiently cooled down so then you can talk like a normal person. Okay. And then I'm going to talk very briefly about vocal health and rest. So here are the things that you should avoid a lot of. All the things that make life worthwhile. Caffeine, alcohol, sugar, no smoking. Stay away from secondary smoke, smoky bars, you know the drill, bingo parlors, chocolate, because that has another chemical in it that can get you a little gummy. Some people don't like dairy. I don't happen to be one of those people, but some people will tell you, oh, no, never any dairy. If that's what is right for you, then absolutely pay attention to your body. On occasion, if you can, have a quiet day. What that means is no talking, no recording, no talking on the phone, no going out to dinner with friends, just even if it's for an afternoon, quiet, right? The second thing I will say is always, always, always hydrate, 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 humidify, 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 especially in the winter. If you can stand nasal lavage, I highly recommend it. And if you don't know what that is, if you know what a neti pot is, I'll just briefly describe it. It is an Ayurvedic technique where you take warm buffered salt water and you buffer it by putting baking soda in with the salt. It goes into a special little pot, looks like a little teapot, and you tilt your head and you put this little spout in your nostril and allow the water to flow up and through your sinuses and out the other side. I know it sounds horrible. And the first time you try it, it's pretty horrible. But when you get used to it, what I've discovered is it allows that cleansing action to get a lot of gunk out. It removes the possibility of setting up an environment where germs can grow. So you will get fewer colds and sinus infections and things like that. But it's also just a great way to moisturize that part of your body, which, how else are you going to do that other than snorting water? Not everybody can tolerate it. I will be very upfront with that. Not everybody can do it. I've taught myself to do it and I love it, but not everybody can do it. Hydration and humidifying your house will do a lot. If you become hoarse, if you feel any kind of tension or pain or soreness or fatigue, stop right then. Take a break, at least for an hour. Do not continue. Do not push through. Do not soldier on, because you will do damage. And over time, that damage can become permanent, and you don't want that. You do not want to have vocal cord surgery. It is not fun. You don't want to be on vocal rest for 6 months, which is what the recovery period for something like that would be. Some home remedies that I use, these are not approved by the FDA by any means. These are things that I've tried. There are lots of them out there. Warm, fresh, not the stuff you buy in the grocery store unless it's fresh. Most of the cartoned stuff, most of the commercially available stuff has been pasteurized, which means it's been boiled, which means that the enzyme that you're looking for has been cooked out of it. You need fresh orange juice. And you warm it up. Don't drink it cold. Herbal tea with honey. Your choice. I like chamomile myself, peppermint, spearmint. I love the mints. Anyway, if you are hoarse and you have a sore throat, warm salt water with a little baking soda. Lovely home remedy. And then if you can tolerate steaming, which is a little easier to handle, all you need to do is boil some water, put it in a giant bowl, put a towel over your head, get some peppermint essential oil, 2 drops, no more, because peppermint's very strong, and just inhale it for 5 or 10 minutes, however long. It's also a nice facial. I'm just teasing. And that's it. My wish for all of you is that you go into every session knowing that you're ready, that you're in exactly the space that you need to be in, head-wise, body-wise, and that you can do whatever you want to do behind the mic and outside the booth. That's all this is about. It's got to be something that brings joy, because if it's hard and painful and yeah, not worth it at that point, right? All right. Thank you all for coming. And I will send out the PDF to, what I may do is just post it in the event. And that way anybody who signed up can go download it. Happy to share it. And if there's ever anything I can do this way or otherwise, please reach out.
Great. Thanks. Good seeing you all.
Thank you.
Evelyn.
Good to
Bye,
see
everyone.
you too.
Bye, you guys.
Bye.
Everybody.